2020 Foresight for a Healthier Benton County. Together with our valued and diverse community partners, Benton County Health Department is embarking on a public health assessment process, during which we will be engaging representatives of critical populations and community stakeholders to create a plan for keeping our community healthy. The goal of the assessment is a collaborative process that results in a comprehensive public health assessment that describes health status, defines areas for health improvement with a focus on improving health equity and eliminating health disparities, and identifies organizational and community assets that can be mobilized to improve health for the entire community. The public health assessment process includes many components. The first is an electronic county health status report. The link to this is available on the Benton County Health Department website, and it provides a snapshot of currently available public health data on the health of the community. The second one is targeted assessments that we've done in the last few years. These targeted assessments allow us to understand about the unique health needs, challenges, and issues in our community that aren't necessarily captured by county-level data. For example, through targeted assessments, we know more about the needs of groups such as mental health consumers, LGBTQ persons, Latinos, and aging rural residents in the community. The third is that this assessment process draws on the knowledge and hard work of our community partners and also informs multiple assessment needs underway in the community, including the Public Health Improvement Plan, Health Services Strategic Planning, Public Health Accreditation, and Healthcare Transformation Initiatives, such as CCOs, the United Way Needs Assessment, and other assessments going on in our community. We incorporated and informed community partner data, such as Samaritan Health Services Community Benefits Assessment and the United Way of Benton and Lynn County's Community Needs Assessment. The fourth step is the step that we're in right now, where we're receiving broad input from community members, people like you who are living in Benton County. This helps us to understand how your life experiences contribute to your view of what a healthy community looks like, what's going well, and what health issues need more attention. There's a brief survey, and a link to it is on the website. We hope that you'll take time to take the survey. It's available both in English and in Spanish on the website, and across the county at different locations in the form of a paper survey. Number 5, our next step is to combine the information that we get from presentations, meetings, and the survey with data from the health status report, targeted qualitative assessments, and community partner data into a written public health assessment that will be available online. The 6th, this assessment will help us to understand the assets and needs in our community and will be used to inform priority setting for a county-wide health improvement plan. It will also be used by community partners for their assessment and planning needs. The information that we learn from you truly helps to bring the perspectives of the community members into the process. Each year, the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute look at many scientific measures and rank the health of counties across the United States. For the 3rd year in a row, Benton County was rated the healthiest county in Oregon, according to the 2012 County Health Rankings. We can all be proud that Benton County is considered one of the state's most livable counties, with a number of educational, economic, and cultural opportunities. Our number 1 ranking is the result of years of action by many organizations, agencies, public health advocates, and engaged community members who all work to make the county vibrant and healthy. One important thing to note, being the healthiest county overall does not mean that everyone in our county has the same opportunities to be healthy. So what influences health? Well, actually many factors influence health. Medical care and personal behavior are important components of health. Much of what affects our health occurs outside the doctor's office, though. Living and working conditions in our homes and communities, and economic and social opportunities and resources have an enormous impact on the health of our county. And the opportunities to create meaningful improvement are greatest when we look at policy changes in those areas. It's possible to improve medical care and to change personal behavior, but research increasingly shows that when we work to create healthier homes, neighborhoods, schools, and workplaces, and when we work to create social policies that increase education and jobs and reduce poverty, we can drastically improve the health of our communities. What we need are policies and programs that help keep people from getting sick in the first place, so that everyone in our community has healthy places to live, work, learn, and play. We all have a stake in creating a healthier community, not just those of us working explicitly in health. Leaders from public health and healthcare, business, education, and government, and engaged community members can work together to create programs and policies to improve people's health, reduce healthcare costs, and increase productivity now and for future generations. Our high rankings reflect the priority that this county has placed on creating programs and policies that create healthy conditions for people in our county to live, work, learn, and play. Tobacco is a great example of how policies have created better health for our community. We know that tobacco use is one of the greatest threats to health, and while we can and do encourage people to never start smoking, or to quit smoking if they start, efforts to influence individual behavior have limited success. Local and state policies, however, have had a huge impact on reducing smoking rates and improving health. Locally, Benton County has long been a statewide and national leader in tobacco prevention. Some important dates to note. The Benton County Tobacco-Free Coalition began in 1994, and beginning in 1996, local school districts became tobacco-free environments. Beginning in 2012, OSU became a smoke-free campus. Local policies and efforts have created smoke-free workplaces, bars, parks, outdoor events like Da Vinci Days and the Fall Festival, and smoke-free housing. Samaritan Health Services and the Corvallis Clinic have adopted tobacco-free campus policies. And most recently, effective January 1st, 2013, all Benton County facilities and grounds, including parks, natural areas, and fairgrounds, will be smoke-free. Community advocates have worked tirelessly since the 1990s to create policies like these that make it easier for people to make healthy choices and to have healthy places to live, work, learn, and play. Hard work pays off. Only 11% of adults in Benton County smoke, compared with 18% across Oregon and up to 27% in some Oregon counties. Continued dedication to policies like these will help keep Benton County the healthiest county in Oregon. There are many examples of how policies have helped us to be healthy. Another great one is that bike paths created as part of land use and development policy in the 1990s have provided opportunities for physical activity that helps our community to be active. Something for you to think about. What policies can we create now that will result in a healthier Benton County in the year 2020? The programs and policies that we create and work so hard to maintain are what provide opportunities for people to make healthy choices. Now let's take a quick look at the health factors, the individual and community conditions and behaviors that contribute to health. You've seen this diagram before. Just a quick reminder as you look at the health factors next, when we look at how to understand and improve community health, medical care and personal behavior are undoubtedly important. We'll look at those first. Physical environment and social and economic factors, though, have a huge impact on people's opportunities to make healthy choices. We'll look at those next. Matching the colors on the rainbow of health that we just looked at, we see that the physical environment and social and economic factors affect people's opportunities for health where they live, work, learn, and play. Clinical care and health behaviors measure people's ability to make healthful choices, to stay well, and to receive care when sick. Being able to stay well through preventive screening like mammograms and being able to get care when sick are important. A few examples of clinical care available in Benton County show that 15% of people under 65 are uninsured, which even though lower than the Oregon average is still a problem. We're fortunate that we have more primary care doctors to serve our population than many counties in Oregon. And for mammography screening, 90% of women in that age group are being screened in Benton County. Benton County behavioral factors demonstrate that many residents are making good personal choices and are taking responsibility. Making the commitment to choose health-promoting behaviors for themselves and their families, to eat a healthy diet, to include physical activity as part of daily life, and avoid risky behaviors like smoking and excessive drinking. We know that the physical environment deeply affects our health. People's health is shaped by the conditions over which they as individuals have little or no control. Many Americans live and work in circumstances that make healthy living nearly impossible, even when they're informed and motivated. Some have limited access to grocery stores that sell nutritious food. Some live in communities with few parks and where streets and roads are unsafe for exercise. In Benton County, we know that almost half of all restaurants are fast food outlets that offer limited healthy choices. And more than half of low-income residents do not live close to a grocery store where they could buy healthy food. We have more indoor recreational facilities than some counties, but rural areas in our county in particular have fewer places to be active. Benton County's social and economic factors shape the conditions in which we live. As a whole, we are highly educated, and unemployment and child poverty are lower than in many parts of Oregon. But not everyone in our county fares well, and we can do better to improve opportunities for everyone. Education plays a powerful role in shaping health behaviors in multiple ways. Having more education may mean greater health knowledge and better problem-solving skills to make more informed choices about behaviors, including those related to seeking appropriate medical care. Economic resources affect the extent to which people can afford to make health-promoting choices for themselves and their families regarding the food they eat, how they spend their time, including physical activity, and whether they live in safe homes and neighborhoods free of physical hazards. The overall poverty rate for Benton County does not tell the whole story. 17% of people in Benton County live below the poverty level. But if you look at the percentages of students who qualify for free and reduced lunch in different county school districts, and then within the Corvallis School District, you can see that we have pockets of poverty. It's important to remember that not everyone has the same opportunities to be healthy. Some people experience significant barriers to better health, and the work that we do as a community is crucial to giving everyone a chance to live a healthy life. For example, in Oregon, persons with substance abuse and/or mental health conditions live an average of 34.5 years less than the rest of the population. Nearly 1/3 of Latina women do not receive prenatal care during their first trimester. The high school dropout rate for minorities is 30%, compared with 7% for the white population. And finally, LGBTQ populations have higher rates of tobacco, alcohol, and other drug use. There are many examples of this across our state. The programs and policies affect people's abilities to make healthy choices, or health factors, which then, in turn, influences health outcomes. On the whole, we are a healthy county. Again, this is the result of priority setting and hard work accomplished over the past decades, such as tobacco policy. We have a lower mortality rate and better self-reports of physical and mental health than other counties in Oregon. And we're ranked #1 for health outcomes among Oregon counties. In our communities, partnerships continue to be formed with an eye towards further health improvement. Although we're ranked very high, we know that not everyone has the same opportunities for health. The 100% Lincoln Project and the Oral Health Coalition are both great examples of how work that is happening now in the year 2012 will keep our county #1 and create healthy opportunities for everyone. The 100% Lincoln Project collaboration performed targeted outreach and enrollment activities for children's health insurance in the spring of 2012, when they realized that students at Lincoln School in South Corvallis had a disproportionate number of uninsured children. The parent-teacher organization and school administrators from Lincoln School, which is the K-8 Title I dual immersion school in South Corvallis, approached Benton County Health Services with an outreach campaign titled 100% Lincoln, the goal of which was to have 100% of the student body with health care coverage. With the program, coverage for children at Lincoln increased from 34% to 98% in just 6 months. The Oral Health Coalition is another example of work that's currently being done in Benton County to ensure the health of our community. Through partnerships with the Johnson Dental Clinic and the Boys and Girls Club of Corvallis, for children 3 to 18 years old and for pregnant women, over 3,600 dental screenings have been conducted in Corvallis and Alsea. They've implemented school-based services for kids to provide sealants and fluoride varnishes and 12 dental vans operated in the county. We all have a stake in creating a healthier community. We can all work together to create policies and programs that support a healthy Benton County now and in the future. What do you think we as a community need to focus on now to ensure our good health? If you remember back to when we were talking about the steps involved in the health improvement process, we will be creating a county-wide health improvement plan. Together with what we know from our data, your input and thoughts will help us to determine priorities for health improvement planning. We've created a survey that helps us to understand what community members feel are important health issues. Please take the time to conduct the survey and even let your friends know about it. The more input we have, the better idea we have of what people in Benton County think. Thank you for your time.